Hello, my name is Renee Russell. Today is July 24th, 2020. This video is for Module 15, our final project on a disease of our choice. Put that in the sheet. So the disease that I chose to do my project on is mitral valve prolapse. So the definition of this disease, it has to do with the two valve flaps of the mitral valve when they don't close smoothly or evenly, but they actually bulge upward into the left atrium. Part of this definition is that is the displacement of 2 or more millimeters above the mitral annulus in a long axis view. In this picture, you can see what a normal valve should look like, what a prolapsed valve looks like, and what the annulus dilation looks like. The annulus is basically where the valves are attached to in that space. So this disease can be classified in a couple different ways. There is primary as well as secondary classification and subtype classifications. The primary classification has to do with the myomectis generation in the absence of any connective tissue pathology. The secondary has to do with its multifactorial, and it has to do with inherited as an autosomal dominant disorder. And this is seen in several different syndromes, such as Marfan syndrome, Ehlers-Danlos syndrome, and these were two that were not very familiar to me. So with the Marfan syndrome, these patients are long, they have long legs, long arms, they're very tall, they dislocate things pretty frequently, they have curved spine. There's a lot of cardiac issues with these patients, as well as with the Ehlers-Danlos syndrome. These patients have loose joints, they have very stretchy skin, and they also have a lot of cardiac issues. Other diseases that fall underneath the secondary category that have the mitral valve prolapse are the polycystic kidney disease, Graves' disease, and those two are more familiar to myself, and the pectus excavatum syndrome, and that is where the chest is like concave in. It looks like from the pictures I looked at, it looks like there's like a big scoop out in the chest, so the chest is very like pushed inwards. To classify mitral valve prolapse into the subtypes, this has to do with what the valve or the leaflets actually look like. It has to do with how thick they are, what type of connection to the mitral annulus it has, along with the concavity of the leaflets. And the subtype classifications are classic, non-classic, flail, symmetric, and asymmetric. So the etiology, it kind of goes with the classifications, has to do with the myxedema degeneration, which is the connective tissue disorder. It's characterized by the thickening and elongation of the mitral leaflets and the coordinate and by dilation of the mitral annulus. I should mention that the spinosa of the mitral valve leaflets actually proliferate with monopolysaccharide deposits and with excessive water content. The leaflets thicken and redundancy. And then also a collagen issue where the collagen content increases and the elastin fibers are fragmented. This syndrome kind of can fall into a few different things. One is the cardiac valvular syndrome, specifically a mitral insufficiency syndrome. And with the mitral valve prolapse, there are a couple syndromes that are very specific just to it. These are a click murmur syndrome Barlow syndrome and floppy valve syndrome, because again, the leaflets bulge. Clinical manifestations, it really depends on the severity of the mitral valve prolapse. Depending on how bad the regurgitation are, or how bad the leaflets flop up, you can have anything from irregular rhythms, irregular heartbeats, palpitations, shortness of breath, chest pain. When you have those, you get down into the anxiety, a lot of cardiac issues. I read that there can be a decrease in blood pressure, and you can get edema because of the blood flow issues because of the regurgitation. So diagnostic tests and results. So the standard right now is an echocardiogram. It has to be at least a 2D, preferably a 3D view. And again, it has to show the displacement of 2 millimeters or more above the annulus. It also, these tests can show thickness of the leaflets. Another diagnostic test is a cardiac cath, and this is normally how it's found basically on accident, is when they're maybe looking for something else or going in to do a heart stent or just to see if there are areas that need to be, worked on, is they can look at the valves and see that there are issues with them. So it's often found accidentally with a cardiac cath. And then something that's non-invasive that kind of gives a clue to physicians that something else might be going wrong with the valve is that you can hear the murmur on clinical auscultation. So when they do a cardiac exam and they listen. So this is a couple pictures that show kind of what different diagnostic tests looks like. You have a 2D echocardiogram, that's A. You have a transesophageal echocardiogram with TEE. You have a 3D TEE surgical view and a 3D three-dimensional of the valves. So especially with C, you can see like the blood flow and where there's regurgitation at. So differential diagnosis, basically anything cardiac-wise. A couple things that you might think it might be are the tricuspid regurgitation or ventricular septal defects. These can kind of present with the same signs and symptoms. Possible complications, it really depends on the severity of mitral valve prolapse. This disease is generally benign, but when you get into more severe complications, you can have arrhythmias, endocarditis, and really severe, you can have heart attacks, sudden cardiac death, and stroke. Then I thought it was important part to include was the treatments for this condition. Most of them, if they're basically asymptomatic and generally benign, it's very self-limiting and they don't really treat for it. If you do start running into complications, they can medicate to you. One of the common medications that I've read about that they give are beta blockers. If the mitral valve prolapse is severe, they might consider surgery and do either a repair or a replacement of that mitral valve. I think it also is important to note that if you are planning on having an invasive procedure, doctors will prescribe to you an antibiotic to hopefully avoid the endocarditis and infection with this. So this is one of the sources, probably the main one I use for all my information, except for it's otherwise noted in the slides. This was a really good article that was done a few years ago, but it had a lot of really good information on it. So, thank you.